Hello, friends. So, when we see the Indian health infrastructure and services facility in the country, it is not in a good shape. Less than 1% of the GDP is invested annually on the public health infrastructure and services, which is something it has been thought through and it has been pushed to be increased to 2.5% even as per the National Health Policy 2017. So that is a requirement from the government in terms of expenditure. Now, in terms of the infrastructure, acute shortages, if we get that context of or the benchmarking from other countries and the world average, then India is having near about zero point 0.5 beds per thousand population, which is 10 times, approximately 10 times lesser than what the China is offering to their people, citizens. And in terms of world average, it's somewhere around 2.7, and the world in fact aspires to be higher than that. But India, as per the policy, it aspires to reach at 2 beds per thousand. So that will be an advancement, fourfold advancement, which is very much welcome. Other things, if we look into in terms of doctors and nurses, then we have, as per a few estimates, we have a shortage of 20 lakh doctors in India and not 20 lakh, 20 lakh nurses and 6 lakh doctors, which is a big number and which is something in a way not at the global standard, global benchmark. If we incorporate the global benchmark, the number will be much higher. And the quality is always a question. So that is also required to be improved. So this entire context is there, and there is a policy at the central level, the national health policy, which is trying to improve things. And health being a state subject, definitely a joint effort of center and state is required to improve the scenario. Now, if we look into the recently launched National Digital Health Mission by Prime Minister Modi during the Independence Day speech, the scheme is visionary. It looks to record the data of individuals as well as from the institutions, hospitals, and all what we get. Now, those data is something which will be on a platform, an application, a software, and that will help understand what kind of health profile the Indians have in different regions of India. So that will help strategists to build strategy to counter the health issues in different parts of India. They can correspond their strategies to the different kinds of problems in different parts of India. So that is something visionary, and here it is required that people and institutions have to voluntarily engage and share the data. Now, this mission will help this recording of the data, that is one. And along with that, there will be a digi doctor or a kind of online doctor who wants to volunteer and support these people who have a medical ID and everything, who have their details recorded here, to get prescription, electronic prescription, easy ones, or to get other kinds of support, telemedicine support, and other things, whatever consultation. That is also something which is possible. In the context of improving internet facilities, this is definitely the future. And in the context of COVID, we understand how important electronic media is to communicate. So this is also important. Then third aspect is the financial support to the the retailers, the people having their medical IDs. In terms of their insurance, they can buy, the insurance company can be on the platform as per the health records. They can easily offer their customized insurance to different sections of the people against different health policies of whatever they offer. So in that context, proper match can happen between the potential patients and the insurance companies in terms of support. Better economic activity will be generated and more customized, in fact. So that way, these three important benefits straight away coming out of this digitization movement is something very much appreciable. And even beyond that, there are benefits which are multifold, And we may not understand at this point of time what other benefits will come out of this, but definitely recording is something which will help. Now, another context, another thing arises about privacy and all. So that is to be taken care of. The data are private and secured. So that part is to be taken care of. And I believe India is capable to secure its data. So a thumbs up to the National Digital Health Mission. Thank you.